Hi, everybody. Welcome to Solo and Smart, my YouTube channel. And today I have a special guest, Pam Cusick, who's the Senior Vice President of Rare Patient Voice. And Pam is an experienced research professional with more than 30 years of expertise in study design, implementation, and analysis. And her background in public health communications and research. And Rare Patient Voice connects patients and caregivers with the opportunity to voice their opinions through surveys and interviews to improve medical products and services. And Rare Patient Voice invites all patients and caregivers to have their voices heard by participating in paid surveys, interviews, and online communities. The link to sign up is in the description below. And when you do, you start talking to the right people. So it's free, and Rare Voice accepts rare and non-rare diagnoses. Well, welcome, Pam. Thank you so much for joining us today.
Sure. It's a pleasure to be here, Carol.
Great. So, Pam, you and I connected via a LinkedIn group, and I'm so happy that we've met because your company serves such a huge need. And when I was a caregiver for both my parents, my dad was living with Alzheimer's, and my mom lived with an assortment of chronic illnesses, unfortunately, bless their hearts. But you folks would have been a godsend, I think, for us, for the family.
Yeah, it's a nice outlet for patients and caregivers to share their experiences. We connect patients with all types of research, as you said, and a lot of times it's nice for caregivers and for patients to be able to share, what they've gone through, kind of their journey to diagnosis, what's happening with their treatment with someone who's an expert in that area. Not their doctor who, they can only see for maybe 10 or 15 minutes, but with an experienced, knowledgeable researcher who's trying to find answers to what better products or services do you need? What kind of information can we provide to make living with your condition a little bit easier? So I'm sorry weren't there for you then, but we're here now.
Is that what your online community does? Does it connect the caregivers and even patients with the researchers?
It does, yes. So
Wow.
we have, our clients are a lot of research companies. They could be doing usability studies. They could be advertising agencies, or even government public health type organizations who are doing research to develop different new products or new services for particular patient groups, different disease areas, people with you might use a specific device that they're trying to improve or develop a better version of. So they come to us with specific specifications asking for, I'm looking to do, a survey with, 100 MS patients, across a variety of, or different areas across the country or even throughout the world. And we connect those researchers with those patients.
Wow. And who sponsors these surveys? Is it companies themselves?
So usually, what we would call the end client is usually a pharma company, a device manufacturer. It could be a government agency that is doing some sort of research on, any all types of things that they might be doing. Doing a study on trying to figure out, risk information.
Mhm.
Do patients understand the risk information that is presented in the packaging, or um, it just, there's so many different types of studies, and in addition, we also have clients that are like a clothing manufacturer, as an example,
Oh,
trying to develop a product line that is suitable for people with mobility disorders, disability. So how do they get their pants on and off? What sorts of things work best for them? And so it really ranges, in terms of who sponsors the study. It's a quite a broad range, but really anyone who's developing a product or a service to help a person with either a different medical condition or a disability of some sort.
um, which reminds me, I haven't signed up yet, and I want to. I plan to. So do they have, because I really don't have a disease at
Mhm,
all.
mhm.
So I'm not sure. That's why I kind of question, should I sign up or not?
So it's, again, we started, as you had said, with rare patients. So we were going to events. We would go to the National Hemophilia Foundation conference or National Sickle Cell Conference and connect with patients with specific conditions. And then we had people coming to us with other conditions like, asthma or migraine headaches or diabetes, which would not be considered rare.
Right.
And those are all important areas there's a lot of research being done in those areas. So, you know, if you have no medical condition, that's good for you, fantastic. But when you sign up, it would be with a specific medical condition. And then, we would reach out to you for that particular issue. So if we had, let's say you did suffer from migraines and we had a study that was doing interviews with patients with migraines, we would connect with you that way.
Okay. And so what type of research is done? Let's say I have a migraine issue. What kind of study would be done? Would I be given medication as a study or just ask questions?
So most of the studies that we connect people with are what we would term like a market research study. So it could be an interview. Let's say a new product is coming on the market for that condition, and let's say an advertising agency is creating some materials around that, and they want to see, well, how do you react to that? Does it make you inspire you to ask for that medication, or does it scare you or whatever? So it might be that type of thing. It could be a company that is considering developing some new product or service, and they want to get input on what are your needs, like what are sort of the pain points for you that they should address to make your life better. So it could be an interview, it could be a survey where they're just getting kind of, reactions to certain ideas, or gathering information about your background and then understanding what your kind of, how long did it take you to get diagnosed, or how long, how many physicians do you see, those types of things. And that helps them to pull information together and then make decisions about, should they go with this, go on this trajectory or that trajectory. And
Okay.
so it could be something like that. We do have some clients that are also involved in clinical trials. So it could be something where they are testing a particular medication. And that would be something that, you as the participant would decide, is that something that you want to do or not? We are
Mhm.
very open with, explaining exactly what patients will be getting involved with. We send out an invitation via email and put the information in. It's a 60-minute interview, and this is what the topic is, and so on, so that you can make an educated decision about whether it's appropriate and you want to participate or not. We pay patients $100 an hour. So some studies, like the clinical research, does not pay that. You don't earn that type of honoraria, for a variety of sort of legal reasons around that are having to do with the government and requirements and so on. But the sometimes clinical trials do pay for travel and things, and that's something that would be kind of confirmed once you decided whether or not you wanted to participate and whether you qualified for that study.
Okay. Well, I certainly like the $100 an hour.
I know, who doesn't?
It'll
Yeah,
pay for
it's
my gas.
exactly, yeah, well, anymore, not much, yes, right?
Right.
Um, But the interesting thing is, and it's a nice, amount of money, and we think that, patients are the experts on their conditions, and they deserve to be compensated for that time. I mean, who knows more about it than the person who's living with it? Even your doctor doesn't, I mean, they don't understand that every minute of your day what you're dealing with. And so, we want to be able to compensate them for that time. And a lot of people say, I would share this information for nothing. But, we want to make sure that everyone is compensated, because I know that it's hard to live with most of these conditions. It
Right.
takes a toll. And a lot of, especially here in the US, there are things that we have to pay for out of pocket. And it helps, even a little bit helps. So
Absolutely. The online communities, you're communicating with other patients that have the same or similar symptoms with a particular disease. Is that right?
no, so
Oh,
we don't have a community like that where people are like a
okay.
Facebook. We do have a
Right.
Facebook page where people
Okay.
can, see information, they can join and get information about Rare
Okay.
Patient Voice. But the when I say a community, it's the each disease area, and we do send a newsletter out to them, which I shared about your book in. But
Thank you.
it is mostly, we're communicating with them about the particular study types that we have. And we have been encouraged by, several different times to create that sort of a community where people can, talk to each other. There are a lot of other places out there where people can do that. So we're sort of sticking to the
Okay.
one thing we're good at, which is research.
Okay. So the online community then only, it really focuses you and the research person doing the research, or the
Right.
research
So that's,
team?
so it's we'll have people sign up, they go to the page, they can put their information in, and then when we have a study that is for that particular condition and whatever they've signed up with, our project managers will send them an email. They can look at it and see if it's something they're interested in, click on that, and then they get connected with the researcher if they qualify for that study.
Okay, great. And so how does this keep their HIPAA protected? It,
So HIPAA is really has to do with what the doctor shares. And patients, as a patient, I can share with you
okay,
whatever I want to share about my own disease. So
okay,
the patient is sharing that. I, s- However, we are very careful about patient privacy. The where we house the data is in a GDPR compliant database, to make sure that, because we do have people outside of the country as well. We want to make sure that everybody's data is protected with the same, the highest level or highest standards that are, out there. And we don't share any information without the patient's permission. So if
okay,
most of the time, if it's a survey, there's no personal information being shared. If it is an interview where someone has to know, oh, I'm talking to Pam Cusick, the client signs a privacy agreement, and the patient agrees to be contacted by the client. So we make sure that
okay.
we're, you know, protecting everybody at every pass. And then the data is again housed in a secure database that has a variety of protections on it.
Well, great. I'm definitely signing up in the
Good.
next few days.
Okay.
That
I'm
sounds
happy.
very interesting. Yeah, because I think it would be, I want to know what researchers are, I mean, what companies, I guess, the types of companies you work with and what they're looking for.
Mhm.
Because if, especially for people like us who are more experienced in, in,
Mhm.
in our own health, and
Mhm.
like you say, we know better than our doctors about our bodies.
Right.
And so I think, yeah, sounds good to me, especially the $100 an
I
hour.
know. Join up. Yeah, we're we
Yeah.
are um we are open to, all people with any type of, medical
Okay.
condition,
Great.
disability, and we welcome anybody to join and
You
for
just have to be
voice.
16, right?
Yes.
16,
Mhm.
16 and over. Okay.
And or you can
Yeah.
be a caregiver of somebody under 16.
Okay. Right. Right. Got it. Okay. Well, thank you, Pam.
Sure
And for
thing.
you, I appreciate you joining me today. And for you listeners, you can sign up for Rare Patient Voice and become a, if you're a patient or a caregiver. I consider myself just a patient because I do have some issues. And so get paid $100 an hour. You can't beat that. The
Yeah.
link is in the description below. Well, thank you, Pam. I
Thank you
appreciate
for
it.
having me. This has been nice chatting with you.